TwinPhon and TwinPhon Extra. Innovative speaking valves with individually adjustable breathing resistance. As variants of a multifunctional speaking valve, they provide new options for the therapeutic treatment of children and adults. Both TwinPhon models enhance the classic speaking valve with its closed basic position by the function of continuously adjustable breathing resistance. This makes individual adaptation possible right up to tight closure. It also extends the range of therapeutic applications, especially with speech therapy. The side air inlets and outlets on the movable lower part are opened and closed with a slight rotating movement. If the air outlet is closed, TwinPhon and TwinPhon Extra guide all air through the upper respiratory tract during exhalation due to the closed basic position of the silicone membrane. Only during inspiration the membrane briefly opens, responding even with very weak inhalation. It automatically returns to its closed basic position at the end of the inspiration cycle, meaning that no inflation pressure is needed to close the membrane. This way, the expiratory air flows completely through the larynx and the upper respiratory tract to enable effective phonation. A simple rotating movement opens the side outlets again. This also individually controls the setting of the breathing resistance. In the open position, the patient can inhale air more easily, but some expiratory air will escape during exhalation. When using the TwinPhon speaking valves, the upper respiratory tract is activated. This has a positive effect on patients in several respects. The large volume of air channeled through the vocal cords results in improved phonation. Patients can articulate louder and more clearly. The control options of the valve enable flexible adjustments to the special needs of patients. Using TwinPhon speaking valves means that the nose and throat area is sensitized due to use of the upper airways. This in turn stimulates the patient's sense of smell and taste. Active breathing also supports the natural coughing reflex in the throat and thus improves secretion management. TwinPhon and TwinPhon Extra are used exclusively in conjunction with a deflated or uncuffed tracheostomy tube. This allows for better closure of the trachea by the larynx and epiglottis. Swallowing difficulties can thus be diminished. If the variable side openings of the valve are in the closed position, a positive subglottal pressure is also achieved when the larynx is closed. This also supports secure closure of the trachea during the swallowing cycle and can thus minimize the risk of aspiration. Overall gas exchange is optimized with use of the TwinPhon models. The restoration of the physiological PEEP in the lungs is supported so that the pulmonary alveoli can expand, leading to improved oxygen absorption in the blood. As an additional feature, TwinPhon Extra features an HME filter cassette integrated into the swivel connector. This enables speech without impairing pulmonary rehabilitation. In open position, the TwinPhon Extra also functions as an HME. The respiratory air is filtered, heated and humidified thanks to the included filter cassette. In closed position, the TwinPhon Extra operates as a highly effective speaking valve. TwinPhon and TwinPhon Extra are multifunctional speaking valves that can significantly improve the quality of life for tracheostomized patients. They facilitate the weaning process and promote quicker decannulation. With their technical functionality, the TwinPhon models ideally adapt to the patient's needs. Both speaking valves can be connected to tracheostomy tubes with a 15mm universal connector. A rotating mechanism enables continuous adjustment of the breathing resistance. The speaking valves are available as variants with or without a filter cassette, which can also be ordered separately. Oxygen can optionally be supplied via the integrated oxygen port. A fixation strap for attaching the speaking valve to the tracheostomy tube's neck strap is included in the scope of supply. Visit our website or contact us for more information. Thank you.